body, it's different joints having an inflammation due to different factors that we would be discussing further. So that is the basic meaning of arthritis. Okay, so if you see, nowadays arthritis has become very common. Okay, so due to different kind of factors that we're exposed to, or maybe different forms of diseases that is leading to any kind of inflammatory problems. Okay, but if you have to see, there are almost 100 types of arthritis. So what the most common is, that is what I am going to discuss about. Okay, so because it's just not like one, two, three that we know. There are 100 types of arthritis that many of them are facing. Okay, so it can be like mild, moderate, or severe. But as soon as possible, if you're going to diagnose it earlier, the better. We could help by taking care on the pain or maybe the inflammatory process that's happening in the body. It can be taken care at the earlier stages. The earlier, the better. Okay, so the very two main types of arthritis that I would be covering today is your osteoarthritis and your rheumatoid arthritis. So if you see, with this, yes, gout also is one of the most common arthritic problem, but we would be doing a separate session on gout because a lot more is needed to talk about that. So today I would be specifically talking about only these two arthritis. So if you see on the screen, so that is how the anatomy of a normal joint is. Okay, so a very normal healthy joint. So if you see, you can see the bone, and then you can see the cartilage, the synovial membrane, where it is filled with synovial fluid, where you will be understanding their functions as we are talking about. Okay, so altogether the membrane that you can see, be it the cartilage or the fluid, basically it helps to like a cushioning effect. Okay, so it helps like a uh, to make, like, imagine if the two bones are not having anything in between, like a cushioning effect, it starts rupturing or the pain is more. Okay, so that is why the this cushion kind of an effect, which is the cartilage, the synovial fluid, is on every joint, so that even though when you're walking or maybe taking up the stairs, the bones are not rubbing to each other and the pain is not creating. Okay, so if you have to talk about osteoarthritis and rheumatoid arthritis, this is how the picture is. But I would be talking separately about it. I just wanted to differentiate. Okay, so these are the main two types I would be talking to you about. So altogether, if you have to see, what is this arthritis pain? What is this causes? So if you see, main thing, pain is one of like an alarm system to your body that something is wrong. Okay, so it can not only be joints, but anywhere in your body, if there's a pain, it means something is wrong in your body, right? So what are the main causes of this arthritic pain? So first thing is inflammation. Okay, so any type of inflammation, maybe due to diseases, or maybe due to the damage of tissues, like through maybe some diseases, or maybe some wear and tear of the tissues are happening also, the inflammation rises up. Secondly, it can be because of muscle strain, like by chance sometimes you have overworked, or maybe due to like overwork of exercises sometimes, or maybe like as we are having this festive season, we tend to overwork suddenly all of a sudden. So what happens is, suddenly you feel the wear and tear of the tissues, which can be an initial stage of osteoarthritis if your age is on the higher side. Okay, third one is your fatigue. Sometimes due to your diseases, or maybe due to some kind of health issues that you're facing, the body is already tired. Okay, where if your body is already tired, the regeneration of the cells or tissues are not happening, which can again lead to any kind of arthritic problems. Okay, so what are the main risk factors, like what are the main factors of getting into this arthritic conditions? Okay, so it can be firstly age. So why age? Because as I told you, as we are getting older, most of our systems are getting weaker, and the production of certain amino sugars, be it amino sugars, or the repair of the cells, or maybe the nutrition is not getting absorbed to the body, where all the systems are getting weaker day by day. Okay, and sometimes the metabolism is also getting weaker. So this is one of the main reason which can lead to the arthritic pain. Okay, Secondly, your osteoporosis. As we know, if your calcium deficiency is there, your bones tend to become porous, where that also can lead to this arthritic pain. Your menopause due to your hormone imbalances that every woman faces. Then your health issues like your diabetes or your BP, which creates a lot of inflammation in the body. Infections, obesity, one of the major risk factor, because more the higher the weight than your normal BMI, it gives a lot of pressure towards your joints, especially your knee joints. So whenever you're walking or you're sitting, always there's a constant pressure towards your joints, which is definitely going to rupture on your, the cushioning part, that is your cartilage especially, which is leading to a lot of arthritic pain. And definitely your smoking, alcohol, which is giving you a lot of free radicals in the body. So sessions by sessions, these have been the major factors of the any kind of diseases or concerns, and so it is for arthritis also. And with this, I have to even tell you that arthritic pain is just not okay, it's because of these factors. Sometimes it can be even an emotional kind of a pain as well, because sometimes when the stress or maybe your sleep patterns are disturbed or you're into depression, what happens is your brain starts giving releasing a lot of enzymes that can destroy the collagen, or that can destroy the cartilage. Okay, so it's just not the physical factors that affect the arthritic pain, but definitely even your emotional well-being also plays an important role, because whenever your stress hormones are getting higher, the inflammation in the body also can increase, which is worsening the pain if a person is already having any kind of arthritic issues. Okay, so taking you further, the first type of arthritis that I said that I'll be talking to you about is your osteoarthritis. Okay, and if you see, this is one of the most common type of arthritis, okay, that we come across. Okay, so again, if you see in the anatomy over here, a healthy joint and a osteoarthritic condition, the bone that you can see in one of the joints. So what exactly is osteoarthritis? Okay, so if you see, um, um, this is type where a degeneration of the tissues happen. Okay, like the cartilage starts to rupture. Okay, so what is a cartilage? If I have to say, it is a smooth cushion, as I already told you. So the more the wear and tear happens, the breakdown of the parts of the joint can happen, which creates inflammation. So basically osteoarthritis means the different factors that I told you, it can affect on destroying the cartilage, which is the cushioning part of the joint. Okay, so that is the main degenerative tissue, which is your cartilage is getting destroyed. So that is the main thing how the osteoarthritis happen. Okay, now this can lead to maybe a swollen, painful, or maybe hard to move kind of a joint as well. Okay, now taking a little further to understand what are the different stages of osteoarthritis. So over here, the first stage, which is the initial, the start, where due to the factors that we were talking about, it can be obesity, or maybe it can be overworking of the muscles, or maybe suddenly your osteoporosis, it can be. So any of this can start by losing the cartilage. So in the initial stages, almost 10 to 15% of the cartilage lost. Okay, now if that is not taken care, it gets into the second stage, which is known as a mild arthritic stage, where what happens is the space, that is the narrowing happens. Okay, so now what happens is the cartilage starts breaking, then goes to the third stage, where the space reduction is seen, gaps in the cartilage are again expanded, and then it reaches to touching the bone as well. So leading to the last one, if we were not taking care about how to improvise on the cartilage or the movement of the joint, it can lead to the last and the fourth stage, which is the severe one, where completely the joint space is reduced and almost cartilage is lost 60 to 80%, where the person, a little walk or maybe taking up the stairs also is very painful for the person. So this is what is the main thing of the osteoarthritic condition. Okay, And now taking you to the signs and symptoms. How do we diagnose that a person is having an osteoarthritic condition? Is definitely you start getting pain, loss of flexibility, a very grating sensation when you walk. Sometimes you have this bone growth or the bone spurs. Then a very tenderness. You feel the bone is very tender whenever you do a little work, or you're able to, suddenly you're waking up in the morning and you see a lot of stiffness. So all these are the main signs and symptoms of osteoarthritic condition. Now let me tell you what are the ways of osteoarthritic may affect different parts of the body. Okay, so if you're having a initial stage or a start of osteoarthritic condition in your hips, how does the pain feel? So if you see a pain is felt in your groin area or your buttock, or maybe sometimes inside your knee or your thigh. So some people having this kind of issues for a long term. So this can be a condition where your osteoarthritis has started. So you need to start diagnose it by yourself, because nobody else can know the pain other than yourself. Okay. The secondly, if it is in the knees, how do you feel? It is, you start getting this cracking sound or a grating or a the major difference between osteo and rheumatoid is osteo, is a condition where your cartilage is, slightly ruptured. But in the rheumatoid arthritic condition, this is a autoimmune disease. Okay, so it is not like, okay, you are doing something and then only the cartilage is getting ruptured. No, this is a autoimmune disease where the right cause is not yet known. So it can be a disease, or it's actually mainly where your immune system has to help you take care, but your own immune system starts to attack on your healthy cells. So this is an autoimmune disorder. Okay. And the main thing is your rheumatoid arthritis can affect any age, but osteo at least is slightly to the elderly age. But your rheumatoid arthritic condition, because it is an autoimmune disorder, it can affect any age group. It can be even at the early 20s as well. Okay. So basically, this targets on the synovial membrane, like how the osteoarthritic condition was targeting on the cartilage. Rheumatoid arthritic condition targets on the synovial membrane, where it starts degenerating it. And the synovial fluid also is slightly like a cushioning effect for the body itself. It's like a lubrication in between the joints. And if the lubrication is getting dried out or getting degenerated, automatically the bone starts rubbing towards each other, and definitely it's much more painful. Okay. So in this, if you see, due to the synovial fluid getting dried up or maybe getting inflamed, the main thing that you can see is a lot of inflammation, pain, swelling. And the main difference that you can see in this rheumatoid arthritic condition is whenever you touch your joint, you feel that it's slightly reddish, okay, to see, and it feels a little warm. So it's not the same in osteoarthritic condition, but in rheumatoid arthritic, the flaring is so high that when you touch your joints wherever it is painful, you feel very warm due to the high amount of inflammation that is happening in this condition. Okay. So this again starts with the morning stiffness. It can be weakness. It's almost the same signs and symptoms that you can see. Okay. Now taking you further towards the stages of the rheumatoid arthritic condition. So over here, first is your healthy joint, as we see. Okay, so with your cartilage and your synovial membrane and a completely healthy joint. But when the inflammation, that is, once the due to different kind of factors, it can be why the autoimmune disease happens. So once it is the autoimmune disease is already like started in your body due to the different factors, be it like smoking or maybe age or genetic, can be different reasons, but the right reason is still not found. Okay, so now what happens is, due to the autoimmune disease, which is the rheumatoid arthritis, your inflammatory chemicals known as cytokines start increasing. Now, what does the cytokines do is it increases on the inflammation. So whenever the high amount of cytokines are produced, inflammation rises up. Now, when the inflammation rises up, it starts degenerating the synovial tissue. So this is leading you to the first stage, which is your synovitis, where your due to the inflammation, your synovial membrane or the tissue is getting degenerated, leading to a lot of swelling of the joint, as well as pain upon different a little motion also. It can create pain. Now, leading to the second stage, what happens is a formation of a fiber, is like a vascular fiber or tissue starts happening. Okay, now that is again leading to dry up on the synovial fluid. Okay, so where the loss of cartilage also starts happening in the second stage. Leading to the third stage, this fibrous tissue is like completely formed almost 60 to 70%, leading to the last stage where the fusing of the bone happens, where the joint starts seizing. Okay, so this is the last stage where when this bone starts like fusing to each other, where the person cannot move at all. So this can happen only in a rheumatoid arthritic condition. So it's always better that when you're having this initial stages, only when you're able to find out the symptoms, or maybe you're able to find out the signs that I'm talking about, it's always better in the initial stages. So start taking care of it. Otherwise, leading to the last stage can lead to seizing of the joint. Okay. Now, again, coming with the signs and symptoms, very similar to osteoarthritis. It's the same thing where you feel fatigue, weakness, you feel a lot of pain while walking or maybe doing any kind of motion. Numbness is there, maybe different kind of a joints. But one thing extra that I told you is you will see a discoloration or a red color on your joint, and when you touch it, it feels warm. So that is the major difference or an addition symptom that you can see in the uh, rheumatoid arthritic condition. Okay. Now, taking you further, arthritic pain management. So maybe sometimes you're not able to like say, okay, is it curable? Okay, but otherwise, if not curable, at least we can still manage the pain, because the main symptom or the aspect of arthritic condition is pain. Okay, and this pain is definitely it's not like a very normal pain that we usually get when we have a muscle strain. Okay, so when joints are actually getting ruptured, the pain is extremely high. And if you see the rheumatoid arthritic condition, pain is much more higher when compared to your osteoarthritic, because of the high amount of inflammation that is happening due to the autoimmune disorder. Okay, so now it's like pain can be managed. It's not like, okay, your age is going on the higher side, so it's not like, okay, we have to like live with the pain or bear it. It's not like that. Make sure that you do some changes or some actions to at least relief on the pain, so that at least the flexibility, or maybe due to some form of the changes that I'll be telling you now, some lifestyle changes can actually improvise on maybe the improvement on your bone cells, or maybe somewhere it'll improvise on the repairing of the tissues. Okay, so what are the main things that we can do is right choice, which means a healthy eating. So understanding the nutrients that can help you relief on the pain of arthritic conditions, your exercises, hot and cold therapies, and relaxation. Okay, so if you have to see, pain signals are blocked by chemicals. Okay, so before I could talk about how do we manage it, I have to say that the brain gives out few chemicals to reduce on your pain. Now, what are these chemicals called as? Which is called as endorphins. Okay, so these there are different ways where the endorphin levels can be improvised. And what are they? As I already discussed. Okay, so firstly, let me talk about exercise. Okay, exercise plays a major role, and in all the sessions we've been telling the same lifestyle factors. Okay, so if you have to see, it helps to relieve stiffness. So in this condition of arthritic a person, it helps to relieve stiffness. So the morning stiffness that they're facing, they're not able to open up their fingers, or maybe they're not able to stand, their suddenly their knee joint lock. Okay, so exercise plays a very important role, and people think whenever I step the pain is more, and they stop doing exercise. That's absolutely wrong. Make sure you do some simple form of exercises, only then the flexibility increases. Okay, so it improves on your posture, your strength, your function, and definitely it will help you to reduce your pains. Now, if it is a normal form of strengthening exercises that you're doing, how is the routine that you need to do? Start doing some warm up first. Okay, so some flexibility exercises, then do some stretching exercises, then you can do some strength training, but again, it's not a high intensity one, a very low intense one. With that, your aerobic exercises, that can be your simple walk for now. Okay, then make sure you do the cool down part of the exercise, because people who are missing on the cool down part can again lead to stiffness of the muscle. So make sure that the cool down part of the exercise is regularly done at least 10 to 15 minutes. Okay, after you finish your strengthening or maybe your aerobic exercises, make sure you give 10 to 15 minutes of your cool down time. Otherwise, it can lead to stiffness again. Okay, that is one. And with this, your therapy. Now, ice versus heat is there. So, which I told you, which is your hot and cold treatments. Now, using a hot and cold treatments or fermentations can definitely reduce the stiffness. It will help you like a complete pain relief for different kind of arthritic condition. Okay. So, if you see, heat works by increasing the blood circulation. So if the blood circulation is lacking, what happens is the inflammation and the pain starts. So definitely having a hot fermentation, hot bag on your joints wherever it's painful will definitely increase on your blood flow. And whenever your blood circulation is happening, automatically the body is getting the perfect nutrients. So that can be towards your joint as well. Now, cold, it helps to reduce on the swelling and inflammation, and it will automatically help you with your repair of your tissues. So it should have a combination of ice and heat, so it will help your blood circulation as well as the repair of it. So make sure that this therapy is definitely followed whenever you feel that the pain is on the higher side. So definitely for the relief, you can use this kind of therapy. Okay, next is your relaxation. Now what relaxation means is just not okay sitting in front of the TV and relaxing. That's not what relaxation means. With that, relaxation even involves in learning different ways to calm and control your body and mind. As I told you in the beginning, arthritic condition or the pain management is just not physical but even plays emotionally. Okay, so you can definitely make the best use of different relaxation techniques or skills to manage pain before it becomes very much intense. Okay, so the first one is your meditation. So a simple 15 minutes of meditation every day can actually take control on minimizing on your stress producing chemicals that can increase on your inflammation. So make sure that you can like just do some breathing practices, do some meditation. It can actually help you to improvise on reducing on your chemicals that is giving you inflammation. Then is your acupuncture. Now, this one helps in increasing the production of endorphins. So, going for this kind of a relaxation techniques is again fine. Third is a form of exercise actually, which is your Tai Chi. Okay, so now Tai Chi is not only physical but again even for your emotional well-being also. Now, this is a form of exercise which is a very low impact exercise that incorporates slow and gentle movements to increase flexibility, muscle strength, and even balance. Okay, so athletic condition person can start following. Okay. Now, with this, I wanted to add that you can even start opting for aquatic exercises also. So if you see like swimming, different kind of aquatic exercises is really a very great form of exercises for arthritic patients. Okay. Next is your yoga. Now, again, as we all know, because of that slow stretching movements, it improves on your joint health. It improves on the movement of your joints as well. Okay. Then comes with your massage techniques. A little slight stroking of the muscles definitely increases on your blood flow, which again gives you that warmth. So the pain relief is happening, and it will help you to reduce somewhere in your inflammation also. Then the last one that I would be additionally adding is something known as grounding, which means or earthing also. Now, what this is it refers to the direct contact with the surface of earth. But again, it should not be a stony region, because if it's a stony region or maybe if it is an irregular pathway, it can affect on the way of walking and affect on the pain. It will be a very soft a grassy area without any kind of slippers, that actually improves on your mood, your sleep, reduces pain, and definitely helps you to reduce inflammation. So try opting for some form of relaxation techniques every day, because that will increase on your endorphins, which will help you to release on the pain. Okay. Now, the major part of that we need to take care is your food. Okay, because food is one of the major thing where you're able to get your nutrition. Okay, so over here I have picked up some anti-inflammatory foods. Now, what are anti-inflammatory foods? It's as the name goes, the foods that do not give inflammation to the body. So one of the major kind of foods over here which are like the anti-inflammatory ingredients, first is your garlic. Okay, so because this improves on circulation, blood circulation, and helps to relieve swollen joints. Then comes your avocado. Now, this is a very great source of property of an anti-inflammatory compound it has. And then one of the major good thing about avocado is, by chance, if you've eaten something that is creating inflammation to the body, avocado has the capacity to reduce the inflammation that you have taken from the different foods. So try adding avocado as much as possible, at least weekly thrice, to your diet. Okay. Next is your fish. Now, again, which is one of the great source of omega-3 fatty acids, which helps to reduce on inflammation, where in blood reports you see it in the form of CRP or ESR that you can see. It does great wonders to reduce on the CRP levels as well. Okay. Next is your broccoli. Now, broccoli again is a very high source of calcium and fiber. And whenever the right amount of fiber is present in your body, it helps to lower the CRP count, as which is equally taking care on the inflammation. Then is your turmeric. Now, turmeric again is having the compound, active compound known as curcumin, which is a very powerful antioxidant and helps with the repair or the regeneration of the tissues or cells. Next is your cherries. Now, cherries again are really good because it contains anthocyanins, which actually helps in the gout kind of condition also, which slightly reduces on your uric acid levels. With that, definitely on your arthritic conditions also, cherries help. Your ginger, and then your pineapple, because of the presence of bromelain, again it is a very good anti-inflammatory property. Your apple cider vinegar, so for few people who are looking for some nice detox water early in the mornings, apple cider vinegar is definitely having a very anti-inflammatory properties, and you can add it as a detox early in the morning. Maybe 1 to 2 teaspoon empty stomach with a glass of warm water can be taken, with maybe you can offer some green tea. And then your nuts and seeds, again a very good combination of your omega-3 fatty acids. So maybe having a ground of flax seeds, chia seeds, your pumpkin, your sunflower seeds, does actual good wonders too. add to your diet, because all of these are having all the anti-inflammatory properties in them. Okay, so make sure that you constantly or regularly slightly increasing the quantity. Add this as a preventive basis also, and person having arthritic condition also can definitely additionally add this. Okay, now as we spoke about foods to include, you need to understand what to avoid as well. Okay, so first main thing is sugar. People having arthritic condition, be it osteo or maybe uric acid or maybe even having the rheumatoid arthritis, completely avoid on high sugar. So definitely no white sugar at all, because taking more of sugar, sweets, chocolates or ice creams or cakes, it can lead to increased amount of something known as AGEs. Now what is this? It is advanced glycation end products. These are main toxins that increase inflammation in the body. Okay, so knowingly already, if you're having an arthritic condition, already your body is facing inflammation. And on top of that, if you're going to increase on the sugar or the salt intake, automatically the inflammation is going on the higher side, leading you to the next stage of arthritic conditions. Okay, fried food. So that can be your junk, fried foods, all of that also increases on inflammation. Processed meat, your soft drinks, alcohol, all of this increase the symptoms of the arthritic conditions. Okay, so try avoiding all of the given below as much as possible. Okay, now what are the major difference between osteo and rheumatoid? As I've already spoken, osteo is a degenerative disease, but rheumatoid is a autoimmune disorder. Osteoarthritis can affect people over 40 years, but rheumatoid can be even at the early 20s as well. Now, the osteoarthritis can be just, caused only to one joint and maybe the larger joints. Okay, maybe if you're having any osteoarthritic condition, it can be maybe as different factors that we've spoke about. It can affect only maybe one or two joints. But rheumatoid, on the other hand, affects different parts of the joints at once. Okay, then as I told you, with the signs and symptoms, with the same signs and symptoms, rheumatoid arthritis, you can see a little discoloration and warm whenever you touch it. Okay, and these are the diagnoses that you can find out, where your ESR, your CRP levels go up, slightly elevates. If you're not able to find out on that, definitely with an X-ray, you can be able to understand the gap between the joints or how your joint health is. Okay, now as we've spoken about so many things, how to relieve on the pain, the major thing that can actually add a support is your extra nourishment, which is your supplements. Okay, now coming with your supplements, the first major thing that uh, should be added in the bucket is definitely our glucosamine HCl with boswellia. Okay, now this is having a combination of glucosamine HCl, your boswellia, your bromelain, your acetylella concentrates, and your citrus bioflavonoids. So this is what it has, a blend of all of these. Now, if I have to separately talk about the ingredients which is present in it, firstly, what is glucosamine? Okay, so many of them think, okay, if I'm diabetic, can I take it? Is how is it? Okay, so basically, it is a protein sugar, which is a amino sugar, which is actually produced by our own body. But due to different factors, or maybe our eating habits or our age, mainly as we age, the production of glucosamine in our own body is reduced. Okay, so basically this glucosamine in our body helps as a building block for the semi fluids in between the joints, which creates a lubrication for the joint health. Okay, so that is mainly glucosamine. Okay, and as I told you, if the production of this glucosamine is lacking due to different factors, additionally adding a glucosamine HCl with boswellia is a great support to take control on our joint health. Secondly, what is boswellia? It is a gum kind of a resin that supports on our connective tissue or taking care on our cartilage as well. And it has great anti-inflammatory properties. Bromelain, as I told, which is a compound present in pineapple, which is again having a great anti-inflammatory property in it, which is again going to help. So this enzyme helps in the support of the connective tissue. Now, if you see all together, glucosamine HCl with bromelain and the different blend that we've added to this actually helps to give you a cushioning effect between your joints. So, by chance, if you're a person with your age or maybe having some problem with your joint function, or you're able to hear some cracking sound, or maybe having some spondylitic conditions, okay, or maybe you're getting the onset of this pain or morning stiffness, definitely glucosamine HCl with boswellia is definitely a must try for you all. As a preventive basis also, this can be taken because this is specifically for the joint health itself. Okay, now the second most important one is your salmon omega 3 soft gels. So if you see, as I told you, in our anti-inflammatory, omega 3 is very, very important. Why? The main thing omega 3 is important is because there are two types of omega 3 fatty acids which is present, which is your EPA and DHA. Okay, now this two together helps to reduce on inflammation, which is the major part of the arthritic condition. So our salmon omega 3 soft gel is having a combination of EPA and DHA, and definitely a very good source to support on your joint health as well as different functions of the different parts of the body. Okay, now, coming to your CalMag D plus, definitely an addition, because whenever people are having this arthritic condition, chances are there that it can lead the person to osteoporotic condition, or it can lead to even bone loss. Okay, so that is why calcium, magnesium, CalMag D plus is important. So just giving you an example of different functioning in arthritic condition, calcium will help to improve on your bone health. Your magnesium will slightly reduce on the inflammation, because whenever a person is having deficiency of magnesium, it leads to more inflammation. Your vitamin D, it helps to absorb the calcium in the body. So if you're taking calcium and there's lack of vitamin D, then the absorption is not happening, so there's no use. So vitamin D presence of this will help to absorb the calcium as well as take control on the symptoms of arthritic conditions. And very importantly, presence of zinc support your immune system and definitely support on your cartilage as well. So that is why this also is a very great addition that can be added to preventive basis of arthritic conditions, or a person having any arthritic problems as well. A very fourth important one is your natural C. All of us know that it's only good for maybe immunity or for the skin. This natural C is equally important for your joint health as well as a support, because your vitamin C will actually help, it actually helps in the cofactor of the collagen formation. So whenever you're having a problem of this pain or maybe some kind of a joint problems, your natural C plays a very important role, and our natural C is having a very good vitamin C source, which is your Axarella cherry. Okay, with this, definitely to improve on your immunity and to control on your inflammation as well. So for people having a lot of inflammatory problems, a lot of pain, or they're facing a lot of the rupturing of this collagen that they are facing, definitely natural C also can be a great support. So these are surely the hero supporters for the arthritic conditions, with the right diet and the exercise and relaxation techniques that I've spoken about. With this, definitely our all plant protein powder and our multivitamin. So again, protein is actually extra needed for a person who is having some arthritic problems, because until and unless the environment, that is your muscles, are strong enough, the person won't be facing a lot of pain. So the muscles more strengthening, it will help you with your tissue improvement, it will help you with your movement of your joints, because every part of your body has cells and tissues where the food for it is your proteins. So definitely addition of the all plant protein powder would help. And a daily, for a person having any kind of nutritional balance leading to a lot of pains or maybe inflammation due to different diseases or different parts, I mean different factors, a multivitamin also could be a great support to take control on the arthritic conditions. So with this, make sure to maintain your weight. That's important. reduce on smoking, alcohol, and depending on different symptoms, different set of supplements can be given. Okay, but these are major ones that definitely can be added. With that, depending person to person, depending upon the symptoms or complaints, you can slightly, shuffle with the supplements as well. Okay, so with this, I end my session. And anybody having any questions or queries, you can ask. Over to Jasleen.
Thank you so much, Susan. I was also actually listening to each and every slide because it is something which is so important and it is common to everybody, starting from any age group as well. You know, nowadays I know that there are so many even younger people complaining about their joint pain or even their muscle pain, whatever it is. So a lot of these things are very common, and all this information was like, pure gold. So thank you so much for sharing it with all of us.
Yeah, thank you, Jasleen. I'm so
So
happy
there
that.
are, I think I can see there are so many questions that are coming up. You also see if you're getting any message which is, worth taking. You can take the question. Till then, I'll ask you the ones that I have got. So, what are some of the ways one can identify arthritis at home?
So as I told you, your stiffening, the morning stiffening, stiffness that happens, or or if you're not able to, as I told you, the self-diagnosis, your stiffening, your cracking sound that you're able to hear, pain is on the higher side whenever you do, you're not able to hold anything. It's a different kind of a pain when compared to a normal hurt that you got. So
Okay, okay. This is another question. Why is it glucosamine with HCl? So, what is the role of HCl in our supplement?
So again, the glucosamine hydrochloride itself will actually, it's a different form of glucosamine. So there are different forms. So it is like glucosamine, there are like sulfate form, hydrochloride form. So this is the one which is present, which is supporting on a joint here. So it's just a form of it.
Okay, okay.
So,
Mm,
so I see a chemical which is AGS is your advanced glycation end product. These are toxins which create inflammation. Okay, so I see that.
Okay. So, Aruna here specifically has asked a very personal question. So, I would request you to get in touch with Susan or Sapna, get a proper consultation and get the recommendation. So, somebody is asking, can we add AVH instead of natural C?
You can, not a problem at all. You can,
Okay, okay. Um,
depending upon different symptoms, you can definitely additionally add it.
Doses of tablets again will not be mentioned here in the open forum because it might be different for each person. So please get in touch with us for your detailed health consultation and so that you get to know the dosage of the supplements.
Here something says, does synovial fluid increase? It may increase the synovial fluid with glucosamine HCl, and the pain management is the major fact. There are chances, person to person, it has reversed and not. But again, if it is in the rheumatoid arthritic condition, because it's an autoimmune disorder, it surely, I cannot give you a word that it can be reversed. Okay.
Okay. I don't know. There's this question. Darshan is asking, can we take both glucosamine and Calmag at the same time? Shouldn't be a
Absolutely,
problem, right? Yeah,
no
because I
problem.
know at a point even I was taking both, so I know it shouldn't be a problem. Yeah.
Not at all, no problem at all.
Okay.
So I
Um,
can see how to reduce uric acid. Well, I didn't cover it up, but yes, uric acid, you just need to increase your fluid, reduce on your non-veg options. That's the major thing. Maybe we'll take a session on that later.
Also, this another question. Usage of glucosamine, does it affect the diabetic situation?
No,
No,
not at
right?
all.
Not at
Nothing
all.
to
Yeah.
worry. No.
Okay. Yeah. So this is one question that how long should we take the supplements? So
Okay, a minimum of 3 months. Okay, so take it and see how the improvement is, and then maybe you can slowly reduce the dosage. But if it's the same, then just give a gap of maybe like a 10 to 15 days and then start again a 3 month supplement form. So, minimal at least 3 months has to be taken.
Okay. Do you see any other question?
I'm just reading. I can see, can we include CFV for reducing? Yes, you can, not a problem. Maybe you can shuffle one by one depending upon the person's needs.
Okay.
Share the presentation.
Okay, this is a very unrelated question, but maybe since you're there, you can give us your expert opinion. So, Jansi is asking, can we have egg daily? Like in general, having one or two eggs daily, is that good, bad? Anything that you would like
No
to
problem.
share?
If you're not having any problems taking eggs, then no problem, because different person reacts with different ingredients in the body. So no problem. Because few people say that having dairy products my pain increases. But for few dairy products actually help. So you need to understand which kind of ingredients are helping you and you can take it. So no problem.
Okay. So I see most of the other questions are something which is again very direct personal questions. So
Personally, yeah.
do get in touch with Susan for a detailed recommendation of what are the products or what are the supplements, what is holistically required, because obviously if somebody needs some exercises, she will even suggest that. So you can have a call with her. I think that's all for today. I would like to thank Susan for again coming up with the wonderful presentation and sharing so much of information on joint health, which we might not be able to get otherwise. So thank you. And yeah, definitely before we close, I would like to wish everybody happy Diwali, and I'm wishing that this year brings you whatever you all dream for, whatever you all want to achieve. I hope God blesses you all with everything. So that's all from my side. Thank you. Stay safe, stay healthy, take care, and we will see you all again very, very soon.
Yeah. Happy Diwali to you all. Take care.